Hello, everyone. Welcome to Tuesday at 10. We are so excited. We have Dave. Dave, how do you properly pronounce your last name? Doan?
Doan, yeah.
Oh, very easy.
Yeah.
Just like it sounds. Thank you, Dave. Dave Doan is here, and Dave is a wealth of experience and information and supports our healthy family staff in case management. Dave is a psychologist, right, Dave?
Actually, a licensed mental health counselor.
Licensed
A
mental health.
therapist, yes. Yeah,
Yep,
kind of interchangeable.
therapist.
There you
And
go.
with your kind of experience, you're way up there. That's all I know. You're very good at what you do, and we are very fortunate to have you. So thanks, Dave, so
Appreciate
much for
that.
being here today. Of course, Doombrook, for those who are just joining us, does child abuse prevention and intervention. The Healthy Families Program, which Dave consults our staff on a consulting basis, goes into the homes and teaches a lot of things. You know, it's expectant moms through to qualify, you have to have a child 3 years or younger. And Dave does the consulting and case management, and he'll talk more about that. So, Healthy Families, we do have our Child Advocacy Center where we interview students, our children who have had suspected cases of abuse. That's our intervention piece. And the other prevention piece is going into schools and empowering kids to take care of themselves. So, we'll get right into it, Dave. I'm so excited to have you here. And, Dave, how long have you been with Doombrook?
I want to say about 5 years.
Wow,
Yeah.
that's great. Right,
Yeah.
that's wonderful. And do you want to tell the audience a little bit about you and your career and how you get going? And
Yeah, appreciate that. So I graduated from VU with my master's in counseling in about 2006. I worked out of here in Porter County in Valparaiso for a couple different mental health agencies, Family Youth Services Bureau, Porter Stark Services, working with children, adolescents, and schools and day treatment programs. My
mhm.
wife and I moved to Oklahoma for her education, and then she is a psychologist. We met at VU also,
Oh,
and
fun.
went to, yeah, Ohio State for her clinical internship. And so it was kind of a cool opportunity in terms of, again, working in different aspects of the country, or parts of the country, working with children, adolescents, and adults. And in Ohio, it was kind of cool. I had a chance to do some prevention programming in schools too, and develop grants and groups and stuff. And so it's kind of a cool opportunity. We came back here, about 6 years ago, moved back to Valpo. And again, I'm based out of kind of Porter County. But that's kind of my deal. I'm right now currently, again, a father of two. And we live here in Valpo. I'm a licensed mental health counselor with Aspire Counseling Services.
Oh, great. Well, that's wonderful. And your practice, Dave, what kind of work generally do you focus on in your practice
Yeah.
in
So
Valpo?
we provide individual counseling, mental health services, family counseling. We have some clinicians here that work with families, some clinicians that work with couples. Currently, right now, I tend to kind of work mainly with individuals, children, adolescents, and adults is kind of the crux of what I do now, in addition, obviously, to kind of working with you guys.
Right. And it's called, can you spell that for Aspire?
Yeah.
Spire?
It's actually Aspire. It's okay. It's
Oh,
A-S.
Aspire.
Yeah, it's okay. ASPIRE,
Okay.
Counseling Services.
Okay.
And again, we're based out of Valparaiso, and we have
Good.
about 10 clinicians here. And yeah, we offer, again, outpatient counseling.
Great. So Aspire, I just want people to know if they're interested in finding out, they can go to your webpage, they can call. You know, I do think it's important that people know that there's nothing wrong, Dave, right, with them calling and saying, you know, this is my situation in general. Am I
Mm-hmm.
appropriate for therapy? Because so many people just don't know.
Yes. No, I think that's definitely, appropriate, to call and to kind of ask, to say again what you're wanting to address in counseling, and to kind of talk with or kind of consult with the person on the phone about whether it would be appropriate, or whether, again, our organization can meet your needs. There's lots of different reasons that people would call in. And again, if we feel like there's a program or a practice that might be more appropriate or helpful, obviously
Yeah.
we can kind of direct you there too.
Great. Well, that's wonderful, Dave. And there's no, if you would, there's no commitment, just to call and ask for information and find out. I know taking that first step for people is
Mm-hmm.
usually a bit of a challenge.
Mm-hmm.
It's a little.
But yeah, exactly. So if you're thinking it'd be helpful, if you have any kind of questions about the services we provide, or you're again wondering if this is appropriate, if you have a particular concern, again, this is obviously a stressful time for everybody. But so yeah, people are welcome to kind of call in and kind of ask. Yeah.
Good, good. And tell us, I guess, a little bit about your relationship with Doombrook. And when we say that you support our clients through helping our staff, what does that look like, Dave?
Yeah. So I work, or I guess I'm under, there's the Maternal Infant Early Childhood Home Visiting Program, which is a federal program that directs funds to, it's a federal program that directs funds to states for home visiting programs that are evidence-based and that use one of their approved models. And so obviously Doombrook uses Healthy Families model. And so within that program, there's a component of it that they encourage basically having a consultant that has, that is either a licensed psychologist or a therapist that can kind of help provide consultation regarding mental health concerns that might come up. So in helping, for instance, a home visitor or family support specialist in navigating, okay, how can I help this, this mom, or this mom has a particular, or dad has a history with either a particular mental health concern or addiction, what are some ways we can support them, or what maybe might be some resources in the community that we can kind of make sure they can take advantage of, or that, that they can at least know are there and available for them. So there's that component that we try to do. Again, if there's a particular case or thing that comes up, that I'm available for consultation, again, regarding those families or those cases. Also, a big part of what we do is monthly reflective practice supervision, which is a chance for the FSS workers or home visitors to, to kind of work through the cases and work through, it's basically a way to kind of, for them to reflect on their experiences and reflect on, their reactions to what's going on, and, focus on their strengths and what they feel like is going well, and maybe ways that they can kind of grow. Reflective practice to me is a really exciting component. It's something that I take advantage of myself, and within the model itself is kind of cool because it looks at the process, the parallel process of, how the FSS worker works with the family. And then again, we have a chance to kind of look at, the worker and kind of their role with their supervisor or with me. And again, I get my own supervision. So it's kind of a cool deal. And again, obviously this first starting step is looking at that parent-child interaction, which the whole point of, the home visiting interaction is to obviously improve outcomes for the family, the mother, and the child. And so It's kind of a helpful way to do that.
Right. That, I know you're enmeshed in that world and have been so long, Dave, but how comforting for one of our clients to know that when they have a support person come into their home, and now virtually because of COVID, that you, with your background, is supporting them in case there is a mental health issue or just a complicated issue, that you support them. Because having been an example, being a counselor in the school system, you have a child that has an issue or a parent that has a question. You never know if it's how deep is the issue. And isn't that a problem in our society where mental health is such a wonderful field that can support people, but some people are afraid to poke the bear and see, oh gosh, do I qualify for even getting help in this area? And you're there to say yay or nay or offer all kinds of great advice.
So that relationships, again, can be really powerful and helpful. And to me, an exciting thing, and one of the reasons I'm passionate kind of about the program and home visiting in particular, is that it allows us to impact a huge number of families, because some families, again, might be open to having a home visitor come in to teach them developmental information or give them tangible ideas and support. And that's something too in therapy. One of the difficulties sometimes in therapy is that there's a limit sometimes tangibly what I can do, that I can't necessarily bring a pack and play, to a family. I can't necessarily provide certain tangible supports. So to me, all right, so I don't have too long of an answer for you. I'm kind of forgetting where I started, but so in terms of, for me, that's an exciting part of the program, and that, yes, that we can help facilitate. I think your point was that mental health is something, again, that people are in different places. Some people are really open to it. Some people maybe have had bad experiences with mental health or just really aren't too sure of it. And so that, yes, it also can be a way that we can kind of have a conversation, and that maybe I can give a home visitor, a way to kind of help explore with the family what their concerns are or what maybe the obstacles might be. For some families, it might be insurance. It might be not knowing what providers we have, that type of thing.
Yeah. Well, and I'll give you an example. Coming from a home with alcoholism, I never knew that there was all that kind of help out there for alcoholism in your family. And every mental health issue has support on all different levels. I mean, you can read about it, you can
Hmm.
join an online support group, you can go into treatment. I mean, it's the whole gamut. And the exciting thing is that your experience opens that door at least to even think about what kind of help someone might need for any
Hmm.
particular issue. And that's just wonderful. In a very non-judgmental,
Hmm.
empathetic kind way, Dave. You have such a great way about you.
I appreciate that.
Well, you do, and that means a lot to people. And I'm sure you know that. Because isn't trust a big issue about whether or not people reach out when you talk about relationships?
Yeah, definitely. In terms of establishing that trust and kind of making people or helping people feel open and allow themselves to feel vulnerable or allow themselves, to let you know what they need is a really important aspect of relationships.
Yeah,
And again, something that for some people, if they've had negative experiences before, they might be kind of more hesitant to do that.
yeah. And just not know how to do it.
Hmm. Hmm.
Yeah. Yeah, the thought of it is can be pretty scary, but if they have a nice trusting relationship with that home visitor and then you come in the picture with additional help and support and empathy and understanding without judgment. I
Yes.
hear that all the time on surveys from our clients that they feel so good because it was done without judgment.
And I think that part of that's kind of the model. I think part of that obviously is the home visitors themselves. I mean,
Yeah.
again, it really is a great group of people, and they're well trained. And I think they know how to provide information and let people know, developmental information that's helpful or safety information that's helpful, and help clients kind of work through that though, without again coming across as, unfortunately, especially with parenting, a lot of moms and dads, get kind of bombarded with lots of information and lots sometimes of strong opinions about, what's the right thing to do, what's appropriate, what's not appropriate, and really don't
Right.
necessarily feel as empowered to kind of make their own decisions as parents. And so I think the model of the program is helpful in that kind of giving parents information and kind of reliable information, but also again exploring these things, like you said, in a non-judgmental way that is helpful for people in feeling trust and obviously the frequency and obviously coming into the home and now meeting virtually, especially I think for people that are isolated during the pandemic, has been a really sure helpful thing, for a person to look forward to having, a conversation, particularly with a parent that, might feel isolated or might not have as much adult interaction, particularly during the pandemic. You can't just necessarily take your kids out to the store. You can't just, go to some places that you used to have gone to. And so I
Yeah.
think that that is again another thing that interaction provides.
Yeah. And great segue, Dave. Our last question, and it's certainly not, if you want to bring up additional issues, that would be wonderful too. But the whole COVID thing, some of our listeners, any one of us, ourselves included, some days we think we're doing great with this COVID. There are other days we're like, oh my goodness, this is such a heavy burden. And some people have lost jobs, having to move out of their living arrangements. I mean, really drastic things have happened to people and everything in between. So I guess a question I have is, given your experience, or what are some of the new issues that you're experiencing with the COVID situation, and what's going on as far as the top problems that you're observing? Sorry, that was Maggie.
No, that's fine. That's fine. Well, I think that part of that too is you kind of illustrated too. I think for everybody um, there had to be kind of a realization again of like accepting things as they are, and I think that's a lot difficulty for a lot of families, for a lot of parents, and in relationships too. That again occasionally, like if my dog barks in the background, I have to get used to that, not feel embarrassed about that. If my child
Yeah.
comes up and and so that is something that a lot of people are experiencing in terms of just the virtual work. For those of us that are fortunate enough to be able to have virtual work, unfortunately, we have some families, that their jobs have been impacted. Either they've, lost jobs, or their jobs right now are kind of on hold, or they have more restricted hours. And so anytime, again, that there's a type of stress, whether it's a stress related to health or concerns about, again, this pandemic, or economically, we know that that stress usually, unfortunately, or does impact us as individuals, but also families. And so we know, for instance, that, since COVID has been going on, there's been an increase, unfortunately, in terms of mental health concerns, relationship concerns, intimate partner violence, and which to me, again, just kind of goes back to support the idea of how important, again, our programs are, and being able to contact families is, so that they're not feeling isolated, so they have the supports and stuff like that. But you're 100% right. It's definitely put a strain. And I think that one thing that's kind of helpful, or that I encourage couples to do, is really work on, their communication, and making sure that they're telling their partners what they need. And that they're, a lot of people will kind of avoid that, or they don't feel comfortable with that, or they feel like that's, needy or whatever. But it's really, again, all about how you kind of say it. And right now, everybody is kind of stressed. And I think being able to tell somebody you need a break, is very important.
Right. Wow. Great tip, Dave. I think that's not only with couples,
Mm-hmm.
to give yourself the green light to say, I'm having a problem with this part of our life right now.
Mm-hmm.
Just that. I mean, you don't have to be strong and pretend everything's okay when, as subtle or not subtle as it is, it's not okay. And what you're saying is to communicate that and
Mm-hmm.
see where the other person's at.
Exactly. No, I think that, yes, letting people, whether, again, it's in your work environment. I mean, because we talk about relationships, but obviously too, in my mind, obviously, a lot of people's mind goes to romantic relationships, but obviously we all have friendships, we have family relationships, professional relationships, and again, interpersonal relationships with ourselves. And all these things, again,
Right.
can be impacted when it comes to this stuff. So for a lot of people, unfortunately, they haven't been able to see maybe their friends as much. I work with a lot of adolescents and teenagers
Yeah.
who, unfortunately, again, some of their rituals and things like prom or some of the other stuff has been restricted. I know my niece is a senior, and she has a sectional, and I don't think she has any fans in the audience. So we've been able to adapt and watch a live stream. But again, like, I think
Yeah.
that but again, this a teenager's perspective. Obviously,
Yeah.
grandparents and other people are missing out on sometimes of seeing their grandkids as much, or all of us maybe are missing kind of that community, those things that, again, that we're excited to kind of get back to. But that does put a strain, and especially when it's one thing too with the pandemic is that we all have different coping strategies, and like you
Yeah.
said, broadly, individually, we all have things, and that and again, with our economy opening up and certain things opening up, it is possible now to go out if you're comfortable to go out and go to dinner. But some things, again, are still kind of restricted, or people might not have the time or financial resources to cope in
Right.
the ways they used to. And we're not able to
Yeah.
cope in the way that we like to. We tend to kind of be stressed, and it's important to kind of, to kind of work on developing other strategies, or at least being patient with each other, whether it's our coworkers or our spouses, or
Yeah.
just members in the community. I think having that empathy is important, and
Yeah.
understanding, again, that you really don't know the situation of somebody else.
Right. Wow. Isn't it, boy, if there was one golden nugget that I think a lot of our guests on our Tuesday at 10 have talked about, it's just that, Dave, is that trying to be patient with ourselves and patient with other people, because you never know what they've been through.
Hmm.
So I love what you said, and you said it right in the beginning of our interview, is accepting the fact that we are where we're at with the COVID, meaning,
Hmm.
initially it was like, what? What? What do we have to do? How, both personally and professionally and relationships. Now we're, almost a year later, 9, 10 months later, and we have great hope that there is a light at the end of the tunnel. But there's going to be a lot of months here before the light at the end of the tunnel.
Hmm.
I don't know that anything's ever going to be normal again if we think normal, but certainly a year or two or whatever that we're re-entering into normal, and to be
Hmm.
patient with that process and
Hmm.
talk about, because it's going to be a whole nother change. We had a change when it happened, and now we're going to have a re-entry change period. And
Hmm.
I think what you're saying is to give yourself permission to speak up when things are not okay.
I think it's important, yeah, to let people know around if you need help, if you're needing a break, if you're needing certain supports, right, or you need somebody to talk to. And again, that doesn't have to always be therapy. There are faith communities,
Yeah.
there's your social support system. I really encourage people to, and that's again, something within the program that our home visitors will do, is really try to help empower, families we work with to really strengthen and utilize their support system, whether that's family that are supportive and helpful, or friends that are supportive and helpful. There's lots of different ways, but relationships are important, and feeling connected really can help us. And whether it's tangibly kind of getting help and support, whether it's emotionally, mental health wise. So no, I agree with you. And the more support we have, obviously it's easier to kind of cope with stress. But it is just, I think, really important, again, to be patient, as you said, and I guess being redundant, but with those around us, if sometimes they might not be able to give us the support right then that we might think we need, and that, again, that we might not be able to support other people as much or in the way that we think we should. And so it's important just to kind of work through that we're all doing our best and continuing to do your best, and hopefully we'll kind of continue to grow through this.
Well, Dave, that is great, great, great advice. And of course, your handsome face is frozen again. There we go. We're back. Dave, what great advice, seriously. I mean, I could sit and listen to you all day, because I think myself some of the, challenges we've had. And I love what you're saying is how important, especially with children, all school age children, to 18, I mean, K through high school, college, is to be creative and think out of the box how you can keep up your social world, whatever that means. If that means going for a walk outside 6 feet distant from your pal, do it, because you need that social interaction, because I agree, that's where we can run into problems if we don't get that.
Mm-hmm. Yeah. And I get, obviously, safety is a component, but you're right. I mean, trying to find a way to feel connected and stay connected to people around you is just so cool. Yeah. Great.
Well, one last plug for you, Dave. Again, Aspire and Counseling Services in Valpo, ASPIRE, Aspire. And if you're interested, give them a call. You can always ask for Dave at some point, right? But also the Doombrook's Healthy Families program for expectant moms and new moms and dads. Instead of being in the home, we do virtual visits. You can call Doombrook. You get a free pack and play just with the assessment alone that we will drop off. So, and Dave, I don't know, but yeah, I go to a lot of community meetings. There's so much help out there. Salvation Army just talked about having something this Saturday in Michigan City, giving out free food. So, I mean, that's just the tip of the iceberg. But with mental health, as you said, you don't always have to go see a therapist or go through formal treatment, but there are ways to get help. But you've got to reach out and ask and keep asking in order to get, what you need.
Exactly.
There's so many different types, right, Dave?
Yeah. And obviously we get to just, again, with our home visitors. I mean, again, if somebody, like you said, and I like your idea in terms of consulting either with your physician, with your doctor, in terms of whether you think counseling would be appropriate, because we all are dealing with stress and we are wanting to cope with that. But there might be times that it might be helpful to kind of see a professional. But in the meantime, again, it's helpful for everybody, again, to try to stay connected and to do things that help you cope and kind of get through stress. Yeah.
Dave, thank you so very much.
Welcome.
We're at Doombrook, and our clients are so fortunate to have you. You're just wonderful.
I appreciate it. And I appreciate our relationship with you guys, and I appreciated consulting with you and being a part of your organization. I really appreciate it.
Yeah. Thanks, Dave. Any last words of wisdom? Anything before we go?
No, I think I've got it. But again, I really appreciate the time, Jeanne. Thank you very much.
All right, Dave. Thanks again. Take care now.